Dr. Kirk Brandow, one of the most highly regarded cosmetic surgeons in the world. He joins us from his office in Bala Cynwyd, Pennsylvania. So let's talk about it, Dr. Brandow. Even if the ban was lifted and silicone breast implants were to come back, would you go there as a surgeon?
No, I wouldn't use silicone implants because recently I've taken so many of them out for leaking problems that I don't really understand why they ever wanted to bring them back.
Are they better as far as how they look, how they feel? Is there an advantage to that over saline?
Well, they certainly have much higher incidence of complication rates. I think where most people like to use them are when they use very big implants. Californians and the Texans like the real big implants, and I actually have an example of one.
Yeah, let's see. Talk me through what you have here. Is this one of the old ones?
This is one of the current saline implants. The ones which are FDA approved and we use a lot. And when you have the larger implants, you can see how it sort of ripples at the edge.
Right.
And when they're silicone, they're more solid. They don't have as many problems. Mm-hmm. But when you use smaller implants, like this saline implant, which I currently use, which will go up about a cup size or so, and I put them through a little invisible incision in the armpit. These are tough. They don't break. They don't. They're very durable, and they don't have the problems that the silicone does. It's the large implants that a lot of doctors are putting in, and like Californians again, who like that fuller look, and they don't have this complication of rippling, which happens with the saline. And I think that implants placed under the muscle can be done through these little tiny incisions like the ones that I do.
That's how
very safe. And yes, and it's how I prefer to do it, but they're safe. They don't have a leak problem. The silicone implants leak through the capsule, like a very fine leak of the silicone.
Well, let me challenge you a little bit on this, because there has been a lot of debate about whether there's a cause and effect for leaks of the silicone breast implants causing some of the problems with immune systems of women and cancer in some cases, because scientifically there has not been a study that said this has caused that. And certainly there's a lot of money pressures by the manufacturers who say this is safe. Still, is it your opinion that you just don't want to go there, you don't want to borrow trouble?
Yes, that's partially true, but I think more than the cancer, or as much as the cancer or these autoimmune diseases, there's a complication rate as high as 46%. Even the company showed it, and over a quarter of them had to be changed and removed. Saline implants leak only 0.5% of the time, so they're not that complicated. And I think with cosmetic surgery, it should be something that's simple, that's not going to cause a lot of problems. And as long as patients know that they'll have to change these saline implants every 15 years, just like you change veneers or you change other things that are in the body, I think patients are willing to accept it. But when the implants get hard, or they need to have multiple operations, this is the problem, and I think this is why the FDA decided not to do it.
Okay, so it's your expertise that says, hey, look, you just don't have as many complications with them, be it one, a matter of health or inconvenience, so you're sticking with the saline. But I know your patients must follow the news and call you up and say, hey, look, is this coming back? Have any women called and said, is it time, can I go back? Would you do this procedure for me?
Some patients have asked me, but I've told them about the risks and the complications. And as I said before, I've taken out so many silicone implants, which are not in the first 5-10 years. They're usually about 12 to 15 years where they begin to develop these sort of joint pains, or they feel sick all the time. And I've taken these implants out, and within 3 to 4 weeks, the patients recover and say that they feel so much better, they're doing much better. So I'll never use them again, and I don't understand why people still want to bring them back on the market.
Talk about some of the pressures from the manufacturers, though, and the evidence that they bring to the table saying that, look, this doesn't cause that, compared to some of the personal experiences and people being upset by this all. Talk about how money just really plays a big role in medicine and how we practice it.
Well, when you talk about this type of a procedure, they're paid up front, the implant companies, and I think that there is a lot of pressure to try and bring back the silicone implants because of the rippling effect from the very large ones. But I think it's unrealistic for people to do it. I go to these conferences and I see the representatives who are saying, you know, more and more people are using silicone implants, but I think that there is a lot of pressure, and they're giving the implants for, you know, a discounted rate. It just is something that I'm glad that the FDA stepped forward.
You're not comfortable with it, and a lot of people who are opponents of it say, look, more research needs to be done. All right, Dr. Kirk Brandow.
I think so.
Thanks so much for coming in, or at least spending some time with us from your office here in Bala Cynwyd. For more information about cosmetic surgery procedures performed by Dr. Brandow, you can log on to www.brandowclinic.com.